Folks, thanks for coming on the line with us today. My name is John Dubas. I'm one of the Vice Presidents for Agent Success for Premier Marketing, and we'll be spending the next hour or so discussing ways that insurance agents can work with providers of care within the different health plans that we offer. We've extended today's presentation to go beyond just primary care physicians, so there'll be some different pieces that come into play here a little bit later. But we've also got a special guest speaker from the WellMed Medical Group that will join us a little later in the presentation as well. A bit of background for you: we'll be recording today's presentation, and it, along with additional handouts, including a PDF of today's presentation, will be sent to you as follow-up. All folks who have RSVP'd to today's presentation can expect follow-up from our organization as well to see how this means of marketing can become part of your overall marketing experience. To begin with, why would you want to market to providers? Well, there are a number of key reasons for that, and of course, primarily, they are an important point of influence to their patients. They can be even more influential than family members. They are a trusted source of referrals, and activity with the patients and clients can be mutually beneficial. Some of the services that you bring to the table help the doctors and their practice, easing some transition of information to the patients. And it's also important to note that many of the doctors are prospective prospects and clients themselves. As we go through and look at some of the different programs that you have to offer, obviously you want to establish a relationship with the practice to begin with, but also as you gain trust with the doctor or other providers, it gives you an opportunity to visit with them and cover their insurance needs as well. When we look at the different categories of providers, obviously we start with physicians, and these are providers of care that have a couple of different categories if you look at it. And many times when you get into a network of a managed care program, you have a couple of different types of physicians that you're dealing with. You're looking at some established physicians who have a separate sort of need than newer physicians. The docs that have been in place for a period of time may well have a patient base that's in need of your services, where the information that you bring to the table in dealing with healthcare and other programs is a valuable resource to that practice. There are also the considerations that you have to come into play where you have a staff that, quite frankly, may not be qualified to deliver upon the information that's necessary to help folks make a clear decision as to their healthcare choices. And in many sources, they cannot do so because of different regulations that are placed upon them. And it's also important to note that many of these doctors also, as I mentioned before, have a personal need for your services. There were a number of physicians when I was in individual production that actually I helped them with their individual coverage, both for health insurance for themselves, a couple of them with their practice, and then, of course, into other means of insurance, including disability insurance for the physicians and life insurance as well. It's also very interesting to note that many agents, as they become involved with an established practice and establish a relationship within the staff, will many times write the parents of the staff or the physician themselves. That was one of the nicest compliments you can take, is when a doctor has the trust in you to ask that you help their parents. Some doctors that haven't been in practice as long may have a need of your services to help them grow their practice. They may have a staff that is in need of training, that isn't as familiar with some of the programs that you offer. And then, of course, they too may have need of your services. So some things that come into play when you're working with doctors, be they primary care physicians or specialists. When you go beyond that and you look at other medical professionals, many of us also work in a retail setting or a market venue opportunity that many of the carriers bring on for you or are part of the Walmart program. And when you think of it, the physicians that you've dealt with when you're delivering primary care are just a little bit different than some of the pharmacists that you deal with, because these people too, depending upon how they're set up in the pharmacy, they may too have a patient base that is in need of your services with the information that you bring to the table, not only on the health plans with drug coverage incorporated into them or PDP programs on a standalone basis, or they may also have a need for your help in knowing about the additional entitlement programs that may be available to them, either through Medicare savings programs or the extra help programs, the low income subsidy programs that can make a huge difference as to the out-of-pocket expenditures that they have with their medication programs. A lot of times too, as you help a pharmacist, you become a resource to them that takes and alleviates some of the challenges that their staff has as well. It's nice for them to have a trusted source to refer folks to when you deal with, well, gee, I'm of lower income. Is there any help I can get with the cost of my medications? And then again, too, the pharmacist may have need for personal evaluations as well. Newer pharmacists that you'll see in many of the chains also have a need to grow that particular business, and be it a circumstance where you're doing things where you're looking to control a different market, a particular subset of a market where you've identified an area that you want to center your insurance practice upon as well, working with these folks to help be a source of information to them, to their practice, to their staff, or to the pharmacists themselves can be invaluable. Additional providers that can be of assistance to you may well entail dentists as well. They have many of the same needs when it comes to the insurance programs that the other medical professionals have, but you'll notice a lot of times when you deal with a dentist, you don't have as much of a network of dentists in many circumstances. The insurance programs that offer assistance with dental expenses aren't as comprehensive, obviously, as the medical programs, and there are then different opportunities to help those dentists with standalone dental programs that you may have, or further explanation of some of the dental benefits that are available through some of the healthcare programs as an ancillary benefit. This then helps that dentist with their accounts receivable, helps them and their patient base, and obviously can alleviate some of the pressure that they have within that practice and that the staff may not be able to deal with. You're a nice option then to help people with their dental expenses, and also then help that particular dentist and that practice with their accounts receivable. Then too, you have a higher earner, a dentist that may be of need of your personal services as well. There are also different subsets of providers that can be a valuable means of referrals to you, looking at home health care agencies, or in this circumstance that's listed here, different durable medical equipment providers. These are also individuals that are very entrepreneurial in nature, and they have also needs that you can help alleviate by the products that you offer as part of your portfolio, but also can be a symbiotic relationship where you're helping them grow their practice and they're helping you grow yours, and you can also help their staff understand some of the differences between private pay and the programs that come into place when you deal with the medical community, or pardon me, the Medicare community in your area. How do you find these individuals? Well, there are a number of ways that you can actually get a list of providers, obviously. And as you work with different medical plans, obviously their provider listings is a list of first resort. So you'll have an insurance company that has a managed care basis about them, an HMO or PPO type of platform. It'll list the docs that are part of it. And that gives you the opportunity as an insurance agent working on an independent basis to go in and help accommodate the needs of those providers within that network. There are also associations, professional associations that will have a list of physicians, and we'll talk about how you deal with the different types in just a little bit as well. There are Chamber of Commerce guides, insurance periodicals. You can buy lists, obviously. Thank God for Al Gore and the internet, I guess. That is an opportunity as well. And then again, the good old dependable yellow pages. One of the things that we have as well is an opportunity in certain areas of working with designated medical groups that are part and parcel of a network for a carrier, multiple carriers in certain circumstances. And these are medical groups that, depending upon how they contract with a particular carrier, may have taken on all of the risk of providing the care for that individual under a health plan, or they may be working with a health plan based on a cost basis. But these are organizations that in many circumstances give us a unique marketing opportunity because they are also tasked with growing or maintaining the patient base of a particular physician group. And we're fortunate enough today to have one of the most knowledgeable folks within that realm on the line with us today to help go through a bit of a presentation that they have for their medical group as well. And so with that in mind, I'm going to ask Miss Aleshia Yarborough to come through and visit with us on the next few slides. And Aleshia, all you have to do is tell me to advance, and we'll go through the next piece of it.
Okay, perfect, John, and thank you for allowing me to join you guys today. This is really exciting and something that I think is a great value to brokers out there in the community. Let me get started. Again, John said, I'm Aleshia Yarborough. I'm the Manager of Business Development and Growth for the Marketing Department within WellMed in the Dallas-Fort Worth market, or North Texas, as we're expanding. It may go outside of the Metroplex there. And a little bit of background, I've been with WellMed for about 4 years. I started as kind of a local area marketing rep, so setting up the tables and community outreach to senior centers, but a large part of my role quickly transitioned to working with our network of providers, because that really is what we like to refer to as the low-hanging fruit when it comes to growing our Medicare Advantage panel with our existing employed as well as contracted providers. So I shifted focus probably maybe about a year into it, and really got in deep with the providers and giving the physicians, mid-levels, and staff some best practice tips on how to work with a broker. John, you can advance, please. So what is WellMed? Many of you that are in Texas, predominantly that San Antonio area, may be familiar, but those of you who aren't, WellMed is a network of physicians who practice a value-based care model for Medicare beneficiaries. Say seniors, I used to, but then I kind of changed my lingo as I learned more about the intricacies of Medicare and the plans. And not everyone, not all of our patients are seniors or boomers, whatever the PC term is these days. But WellMed we have a care model, and it's strictly for Medicare beneficiaries, focused on prevention and wellness. We believe in treating the patient as a whole, not just their symptoms. And that not only applies to their health care, but as well as their kind of social needs as well. Our providers who practice our model, again, we have some employed, WellMed branded and other brands that we own, clinics and physicians. We also have contracted physicians who may accept multiple plans, but what makes them unique is joining our network, they follow our care model, which really helps them focus on quality and performance versus quantity. So that old fee-for-service model for a physician to keep their lights on, it's about the RVUs, and almost like cattle, the more patients per day, the better for them. Ours, we are able to capitalize upon the health care provided. At the end of the day, the patient receives better quality health care, physicians' performance scores go up, and ultimately leading to the overall health plan rating, and the goal is to become a 5-star plan in our markets. We have over 150,000 primary care physicians, specialists, ancillary providers, and mid-levels throughout Texas and Florida. Okay, John. You may advance. So just a little history, and then I'll get into the good stuff. But we were founded in 1990 by a physician named Dr. George Rapier, a single standalone clinic in San Antonio, Texas. You know, Dr. Rapier, as he was treating his patients, he, you know, had a few patients, they were seeing specialists, they were on medications, and some things were happening that were pretty detrimental to their health. And so his, you know, goal was to create a preventative care model and program, and really build a stronger relationship with his patients, and hopefully helping them before they came ill. So being proactive versus reactive was the premise behind this machine we now call WellMed. So that one clinic in 1990, and again now we're over 150,000 providers strong. Our mission is to help the sick become well, and to help patients understand and control their health in a lifelong effort at wellness. And our vision truly is to change the face of healthcare delivery for seniors, still says seniors, but for our patients, we should say, just by providing that quality and proactive patient care with a focus on prevention. So proactive prevention and wellness, that is what WellMed is in a nutshell. We can proceed, John. Okay. Did you know, and I heard John allude to this earlier, about physicians making or their influencers. With the senior population, their go-to is family, clergy, and physicians. Oftentimes the physicians are more influential over the patients than the family or clergy, their pastors, church members. But that is, in a nutshell, kind of across the board throughout America, where they get their where they make their decisions, especially when it comes to anything pertaining to their health care, health plans, are the physicians. Any provider, they can inform their patients of relationships with a licensed broker or agent. Physicians can inform patients which plans are accepted within their practice. They can also make available materials in waiting rooms or common areas. And as first thing I tell our providers that are new into our network when we meet is they need a broker. I don't care if they do anything else, they need a broker. And I feel that the brokers need the physicians also. John, you can proceed. So, yeah, there we are. Okay. Some tips when you're establishing a relationship with a practice, and these are bits and pieces from my overall kind of plan. So the wording kind of sounds a little funny. I try to make it a little interactive when I do it. But the biggest thing I say is don't be a nuisance. You do be a resource. When I meet with providers to educate them about working with a broker, and I am quite often surprised the physicians that are in senior care that say that they do not work with a broker, you know, right from the beginning. And the first thing I tell them is, why do you not have this resource in your clinic? I try to get our providers not to look at you as a salesperson. at the end of the day, understand commissions are how you, keep your lights on, feed your family, earn your living. And providers, they also know that too, but they need to understand that truly at the end of the day, what we consider a quote unquote great broker is one that's a resource to the clinic and to the provider. So when I say don't be a nuisance, I mean, understand clinics are busy. Their first priority is patient care. And going in and, kind of understanding that you are ultimately, anytime you step into a clinic, you are a disruption, but you can make that negative into a positive. Communicate with the clinics, find out when's the best time to stop in. I had a provider recently tell me that, they didn't want to work with this particular broker because he always came in on Fridays. My first question is, have you communicated this to the broker to ask them not to stop in on Fridays? That is, their worst day. They're half a day, they're cramming people in. So, just a little change like that, the little things really do make a difference. Don't be discouraged. When I say that, it often takes time to build relationships with clinics to where you actually start seeing those referrals come your way. It doesn't happen overnight. There are even some of our best physicians who are, I'll call engaged for growth and their staff. They don't get it right off the bat. It is a process. So don't get discouraged. Do be consistent. Don't give up. If you're telling them, if you've worked out a schedule with a clinic and you want to stop by, even if you don't have it, be consistent with trying to build that relationship. Don't be, expect to stop in every 2 to 3 months and them to know who you are, trust you, and want to work for you or work with you. Don't take things for granted. Understand that this is ultimately, at the end of the day, hopefully going to lead to sales for you, and as well as panel growth for the physician. Don't take it for granted. If a clinic, gives you an opportunity to start working with them, don't do things like just walking in and, automatically going to the back. They are a medical clinic. They are bound by HIPAA laws and things like that. So be grateful for the relationship that you're establishing and that you have, and always be professional and respectful. And last, and all in caps here, is just don't give up. Again, I have, some real live examples that I can share with you, but we have a provider who's been a contracted physician in our network in the Dallas-Fort Worth market for 4 years. I literally had a conversation with a broker that works with his clinic yesterday. Now, this physician for annual enrollment period had a growth of net growth of 70 new patients on 1/1. That was amazing. The broker and I were having a strategy session yesterday, and he had made the comment that he tells his new brokers, his downline, about not giving up. That didn't happen overnight. It took probably a good year for the two of them to really mesh well, for the staff to learn to trust him as a broker, and ultimately understand that at the end of the day, he is a salesperson too. He is a resource, but he's a salesperson too. And the service that brokers provide to Medicare beneficiaries is invaluable. I mean, it is, you can't put a price on that, the peace of mind. So it does take time. John, you can move on. Go back one. So the little things, I like to call this, hey, this should be common sense. And I have gotten some of these tips and bullet points from actual providers that I work with on a regular basis, kind of what they like to see when it comes to working with a broker. Dress professionally, that's me, but also your audience. If you're in a clinic that's, in a very low income area, or it's a little more casual, you don't want to go in 3-piece suit. You really want to kind of fit your audience, but regardless, you want to look professional because you are a professional. And I think you should exude that, and the providers appreciate your presentation per se. Smile. Go in with a open attitude, even if there's, you've signed a client up and there's an issue with getting, their first appointment in a timely manner. Don't go in with an upset attitude with the staff in clinic. Smile. Even when you pick up the phone, smile. I do that. Even if I'm in a bad mood, I force myself to smile because you exude a different type of persona when you do that. Always remember that, again, as I've said, relationships do take time. Think about the people you know and you trust. Did that happen overnight? If it did, great for you. But for me, I'm the type to really have a relationship. It takes time and effort. People like to do business with people they like and trust. That is true. We all have our favorites. I have some of my favorite physicians, and I actually enjoy the work I do with them. I still do it with those that I may not like as well, but personally I get satisfaction of really the ones that I like better. That's just human nature. Remember that this is a two-way street. When you start working with a clinic or a provider's office or group, referrals are ultimately what you're looking for. But if that clinic is only feeding you referrals and you're not bringing anything to the table, I don't think you're being valuable. They won't see your value either. Remember, it's a two-way street. If you've got a book of business or a new client in the area, feed them some new organic growth as well. Little things like getting to know the staff. Keep a notebook, get a journal for each clinic you may work with. How many staff members are they? Who are they? Who does what? Learn what they like. People enjoy that, and that goes back to people doing business with people they like and trust. The little things like that. Ask, front desk. She had a little girl. She was out the week before or something when you stopped in because her child was sick. Just ask the personal things. Get to know them. The growth goals of the clinic. As I said, with the two-way street, some clinics may not want new patients. They may really only want to start converting or compliantly educating, I shouldn't say conversion, compliantly educating their existing patient base about the health plans that they currently accept. That's what we refer to as a conversion within a clinic. Some don't have, if it's a new clinic, they may not have a conversion base or a big fee-for-service Medicare base that could benefit from a Medicare Advantage plan. So get to know what their goals are. If you've got a provider who has maybe 100 fee-for-service patients, and he tells you he's got a growth goal by the end of the year of 200 patients, have those kind of conversations and explain about that low-hanging fruit. Those patients that are currently in the practice are kind of an easier target for growth of an MA plan than organic growth. I often tell our physicians refer to growing a panel as a marathon. It is never a race. AEP is kind of a mini race, I guess, but I think every month you should look for opportunities. Ask questions. If you've got providers who you're working with a clinic, and again, they've got this, big growth goal or even a small one, ask the questions. What health plans do you currently accept? Which ones do you not enjoy the most? Providers can't steer, but their brokers can kind of know their wants and where to go. And, are you open panel here? Are you accepting of this? Are you willing to accept new patients? Do you only want conversions? The more you know, the better it is for you to do your job. Always be honest. When you're working with a clinic, as I like to say, you're a clinic resource. There may be some customer service type of duties that you take care of. Somebody already on one of the MA plans accepted by that clinic, and the clinic comes to you with a question about the intricacies of the plan or something, and if you don't know, be honest. Don't wing your way through an answer. Tell them, I'm not really sure about this. I need to look into it, and I'll get back with you. Or again, a growth goal. If you've got this provider again that has 100, small conversion panel, and they're wanting this crazy growth, be honest with them about what you feel realistically you can do. Always under promise, over deliver. That I think is probably should be in all caps there, or bolded, or something. The providers that I've polled and talked with that have had the most successful growth periods with their brokers, that's one thing they've said, that in the past they don't like being made promises and it not happening, and they will remember. So always kind of promise on the lighter side and then just wow them with what you do. And again, follow up, always follow up, whether it's reporting to physicians, work out a reporting schedule. How would you like to know how your growth is going? It could be by email. Set calendar reminders, keep that notebook, remember to follow up with them. If they've asked you some questions about some plan benefits or prescription drugs or something, anything, make sure you follow up with them. They do remember, and it often, I find personally, I get calls. My broker was supposed to tell me this and they didn't. So, then I'm like, well, I tried, when was this? Oh, yesterday. Well, what, give them a chance. So back to the communication with them, setting clear expectations and doing your follow-up. Next, things that are in your control. I personally find working with physicians and brokers, I'm kind of the go-between here at WellMed in our market. There are a lot of things you can't control, but let's focus on the things you can control to keep our sanity. You are of value. Clinics may not realize it yet, and again, going back to those relationships, it takes time, but always remember that. You're of value. You do make staff life easier. CMS, who we are all privy and subject to their guidelines, and that including providers, they have their own set of rules, and their staff. They should not be talking benefits of health plans with patients just because as they change from year to year, and there may be a clinic that accepts many plans. They're not going to know the intricacies of it. That's why they need to depend on you. You can make that life easier. You've got a patient that's calling Betty at Dr. E's office, and they had a denied claim for something, and if it's not, well, I won't use that, a drug problem or something that has to do with the health plan coverage or whatever, you can take that off of the staff. Have them start saying that customer service, have them call me if it's anything to do with the health plan, a benefit. You can take kind of a burden off the clinic, and maybe they'll be a little more friendlier and open to brokers if you show them the value that you bring to them. And also, you make the life easier of their patients at the end of the day. And it's a beautiful thing when clinic staff, providers, whoever it is, the billing person realizes that. They've got a patient that may have a outstanding bill, or they're not coming in because they can't afford it. And it's because they're, on a plan basically that's wrong for them. You're doing a service and a value to their patients and to them by being a broker working with their clinic. So that is something that is only you can control, that, showing them the value that you have. Always be prepared with tools of the trade. That is in your control. I would say, as many of you probably do, keep some materials in your vehicle or whatever. You never know when you're visiting with a clinic. Tell them what you can provide them. They want some specific plan info that for them to have, or if they need some specialist directories, things like that. Tools of the trade are within your control to provide to the clinics. And again, it goes back to being a value to them. Availability, and that is misspelled. I just noticed that. Wow, I've been using this for a while, and this is the first time I've ever noticed that. That's funny. So anyway, excuse my lack of using spell check there. Availability, always making sure that you have ways it means to be available to that clinic, whether making sure that they have your business cards, your flyers, things like that. Health plan information and the tools of the trade are great, but there needs to be a solid call to action where they can get a hold of you. They can make sure that their patient is getting your card, your flyer, and all of that. And if you can't answer, as I understand, most people go to my voicemail anymore. Be sure that you're available to get back with them. Set some time. Also within your control is showing them that they are your focus, that they are important, and their needs matter. That is one thing that is, again, will show your value to that provider. Everyone wants to feel special, and you may be a superstar and you may work with 5, 10 clinics, but each and every one of them needs to think you are their primary focus, that you are there for them. Help me help you. Also within your control is your expertise, your knowledge of the products. And I say the election periods too, making sure that, if it's a special election period, letting the staff know or the provider know that it doesn't matter what time of year it is, you are the expert. If changing out your flyers and trifolds, things like that in the clinic to fit the election, that does show value. I've had some providers tell me that they love the fact that their broker's bringing them different messaging throughout the year. It really shows that they know what's going on during the no, this is the now. Again, with annual enrollment period coming up, putting that message into your clinics with your collaterals, that's also helpful. And also knowing your product. I feel like, please don't think that I'm dumbing it down, but, I know you do trainings on the different products and stuff, and you are the expertise, or you're the expert on that, but make sure that, you can control showing your providers and clinics that you are the expert there on these things. Also in your control is to know the extras. So working at WellMed, when I said we like to treat the patient holistically, not just their health care, but also helping them qualify for any special help or connecting them with various community resources. I learned as I came to WellMed, as brokers, many of you have your own kind of network of special health programs and things, whether it's working with drug manufacturers or drug companies for some low-cost things. Showing the providers that that goes a long way, that at the end of the day, you're really providing a service to their patients by knowing those types of things and how to connect their patient base with any extra helps they may need outside of just a health plan and the benefits that come with it. Communicate. That is in your control to communicate with your providers. Each office is different, each physician, each office manager, none of them are the same. So control the flow of communication. Let them know what you are doing as they are your focus, and how you're doing it. Work that out with the clinic. That comes back to the communication, showing them you're the focus, you're available for them, and you're following through. And being prepared is within your control. If you are able to get in with a clinic, off right from the start, I think it's best to have these things already in your realm. This provider, you kind of wowed him with showing how much of a value you can be to this practice. Go ahead and have your flyers, some flyers printed up and available, and little acrylic stands to go on their counters or whatever. Have that ready. Have your business cards. I have been in lots of meetings before with brokers says, okay, well, I don't have anything with me, but I'm going to come back. Don't do that. Go in prepared. Go in with a positive attitude, knowing that you're going to establish a relationship with this clinic and you're prepared to do it, and you don't have to, say, hey, let me get some time on the calendar or come back to put these things in. Go in prepared. It goes a long way. It really does. And basically I say that's when you should always be ready to shine. You are the expert. you are prepared, you've got the tools of the trade at your disposal, and they're your focus, and you came in prepared for their meeting. Okay, John. So next level. So taking the relationship to the next level. Again, as the broker, you really bring a unique value and service to clinics. You know, as the next step, creating those opportunities for growth. Again, like I said, it's a two-way street oftentimes. And I have had providers that say, you know, we provide them with their growth reports. And I've had a couple of providers say, yeah, well, you know, this broker's great, but they're not bringing anything to the table. All they're doing is converting our existing Medicare patients. So, you know, if you've got providers that are looking for some of that organic growth, create opportunities. Look for, you know, some LAM events around their clinic. Try to stay within a 5-mile range if it's something you would like the physician to possibly attend, or a staff member. That's always a good rule of thumb, within 5 miles if you can. So look for those senior centers, the church groups, wherever Medicare eligible people may congregate, and set up some LAM, which is local area marketing. It could be that you go in and something as simple as hosting a bingo on behalf of this provider that's in the area. The health plan partnerships, if there's retail locations around the area, you know, find out if you can promote the clinic or provider there. Any, you know, general advertisements that you may be doing, community meetings around that provider's clinic. You know, there's a whole different way, and I think John could probably do a webinar solely based on growth opportunities, but that's kind of the top 3 that I kind of look for, or have been most prevalent between the conversations I've had with some brokers and our providers. Be a problem solver. Don't create problems. If you know, brokers can be very territorial, and I get that. You're salespeople. One of the biggest issues I've had in clinics that may work with more than one broker is had a broker come in and remove the other person's materials. Those things cost money. It may be that I've paid to have them printed, and that really does kind of tick me off. But regardless, if there's some sort of print material or business cards or something, somebody somewhere has paid for them, and you know, they removed the other broker's materials, and there was room for both people to have their materials on the table. And the other broker came in and went straight to the office manager. The office manager went to the physician. Then I got a phone call, and you know, be a problem solver. Try not to create the little problems like that, which end up becoming nuclear at oftentimes, depending on the personalities involved. So that's really kind of, you know, to help and show your professionalism with these clinics and solving problems before they start, or preventing problems, I guess. Know your provider. Value-added services. You've got a clinic that is open on Saturdays, you know, for urgent care or something. Get to know about the provider, the clinic. And when you're out there talking to your clients, make sure that you know those special things, or you've got, you know, your provider is on call 24/7, you know, call us first before you start going to the emergency room. You know, your provider's got this special after hours line, things like that. Again, keep that in the notes that you may have for that clinic. And think outside of the box. So that's kind of a, you know, I really don't have a true definition of this because we're thinking outside of the box, but knowing your clinics, or, you know, as you get to know them, you know, the same old things may not work. Don't be afraid to come up with some new ideas for growth for your providers, and, you know, communicate that to them. We've got some providers that this year, you know, we're kind of like, okay, well, we like the senior center talks and all that, but, you know, we'd like to do something a little different. So, you know, we're starting to create like speed dating, but with the doctor. And so we have you know, event at a senior center, and you know, it's a clinic that has, you know, 5 physicians, and so all 5 of them are going to be there, and we're going to do, like, instead of speed dating, it's like speed docking, where, you know, they have a timer and some, you know, questions and go around, and so that's just a little something different outside the norm that we do, and it's been a kind of a big hit when it comes to the providers. I think the audience, the seniors, they enjoy it, and the physicians definitely do, and it's kind of a hoot. So things like that. You know, they always say there are no bad ideas. I disagree with that because I've had some very bad ideas myself. But the thing is, let's try it and see if it works to help with growth in sales. Okay, John? That was it for me, so I'll hand it back over to you, John, and I'm here if there are any questions or however you want to do this, but I'm going to give you back the reins.
No problem. What we'll do too is make certain that any of the questions that are asked that pertain to the presentation are sent out as a overall list to be shared by all, so we'll go through it. We've got a number of additional things that we ask to remind you of, and Aleshia and I think a lot alike on how we address some of the different pieces of approaching a provider marketing campaign. Obviously, the dressing professionally and smiling. One of the things that I would seriously recommend that you do is not ignore the person at the front desk. The gatekeeper may change over time, but they are critical to your success, and it's important that they know who you are and that you are of value to the practice that you are approaching, and the people know you as a person as you grow to know them as well. Some of the things that then you can do, obviously, is make certain, as Aleshia mentioned, make their job easier by providing tools with the different plans that they have available. To think outside the box piece, well, it's not always a good idea to go into a doctor's office and leave a candy jar, but if you leave a candy jar with sugar-free candy in it, it's a little bit different situation. My sister was a nurse, and there's no way that you as an insurance agent can out pharmaceutical rep a pharmaceutical rep. So some of the things that you come into play here with the different goodies is making certain that you're doing things that can help them with their practice as well. So that's something to be very conscious of. As Aleshia mentioned, it's important to vary your focus throughout the year. Right now, we're in a lock-in period, but who knows better than a physician as to who's aging in or who may need assistance with the cost of medications, different things that allude to a special election period. So there are different things that come into play. And you are obviously an independent insurance broker. And as Aleshia alluded to before, there's no one right solution for everyone. So we have to make certain that we're cognitive of the physician's opinion as to a payer mix. They may not want all of their patients on a managed care program. Some of them, it may not be appropriate for that individual. So it's important that we provide that information in a timely fashion, but also with the knowledge and the research that we've done on the back end of it. We've already talked about getting to know the office staff and making certain that they know who we are and what we have to offer. And that includes sharing the information that helps them grow their practice if that's what they want, or create an opportunity for conversion to a particular plan that suits their patient base. It's also important to note that not every provider is part of a network. And so that gives us an opportunity with other doctors or influencers within the community to act as their advocate as well. And that may be as simple as working with a specialist to make certain that you offer Medicare supplement reviews to help minimize costs for that patient base, or making certain that if a primary care physician is in an area and is not part of a network, that we offer the services that we have as part of our portfolio to help that provider as well. Aleshia's gone through a lot of the different pieces here, but an important piece to keep in mind is that we are individuals They're people as well. We need to establish a relationship and earn the trust. One of the challenges I've seen in many circumstances with insurance agents working with a provider is going in asking for a patient list or some of the things that a doc just can't provide. And they're doing it on a very aggressive basis without earning any trust or without making certain that they're doing the right thing. And so we're going to spend a little bit of time talking about the right thing. Get to know what is important to the practice and make certain that you make that doctor, that practice, that provider part of your overall marketing program for that area. We do have a program tomorrow, as a matter of fact, called Community Grassroots Marketing, and that deals with an overall approach to a particular market where you've identified your target within the community and how you work all of the influencers within that geographic area. And I'd invite you to attend that presentation as well. Some of the things, obviously, that's really important for us is to also stay up to date. So to Aleshia's point of being knowledgeable, make certain that you, if you don't have them memorized, well, you know the low-income subsidy numbers, the MSP numbers. We have a presentation we've done on that as well. We'll make certain that the link to that presentation, so you have those details in your pocket, so to speak, come as part of the follow-up to today's presentation as well. Making certain that you leave items of value behind. There are some very nice pre-approved generic pieces that you can use. And then, of course, if you're working very closely with a particular Medicare plan or medical plan in general, they generally have great marketing pieces as well available to you at no cost. I know many of the Medicare Advantage carriers are very aggressive in some of the material that they make available to you without you having to come out of pocket for it. One of the things that I would very strongly suggest to differentiate yourself from every other Tom, Dick, and Harry that's walking into a provider's office is you get to know the people, you get their names. Once you're gone, send them a thank you note. When's the last time you got something in the mail that said, hey, thanks for your time, I appreciate it, I look forward to establishing a relationship, and then be consistent in that follow-up effort. Aleshia mentioned it's not a microwave type of activity. Many times it's establishing a relationship, showing your value, differentiating yourself from everyone else that pops in the street. That can make a huge difference to you. And another thing, as you reference that provider, make certain that you communicate to them that you are bringing value to their practice, that you are sending new patients to them if they're looking to grow their panel, and make certain that they realize that you're of value to them as well. So some different pieces that come into play there. If you work with a medical group such as WellMed, obviously making certain that you work with the representative of that organization and then they know who you are, and that can make a huge difference to you. Some of the things that we see here in the next few pieces are pulled from the Medicare marketing guidelines that were updated this last week, and that's going to come to you as part of the follow-up to today's presentation as well, where you see different coding that will come into play with what you can and cannot do. You can make information available to the physician, but you can't just drop it off. You have to have their permission, and it has to be in particular areas where it's legal to do so. You have an opportunity also to realize what a doctor can and cannot do, what a provider can and cannot do on your behalf. That can vary from provider type. You will see in many circumstances a physician and a pharmacist be subject to much of the same regulation. Dentists, not so much. So some different things that can come into play as to what you can offer and how you can provide that material. It is important to note that we've got the guidelines set for us by CMS, and we simply need to be aware of what those guidelines are to make certain that we're doing things properly. Keep in mind, a doc can't make an appointment for you. They can't complete a scope of appointment for you. They can't make phone calls or steer patients to you in that particular fashion. So we've got to make certain that we follow the rules. So some hard and fast guidelines as to what came out in the marketing guidelines of this week. They can't accept or collect scope of appointments for you. They surely can't accept enrollment applications for you. They can't do an outbound call campaign for you in that circumstance or mail the material based on a particular plan. They can't induce their patients to enroll in any particular program. You got to be careful too when you have a physician or a staff member involved in a marketing activity. There are certain things they can and cannot do, and that behavior influences what you can do when it comes time to collecting information to recontact those individuals. So some things that come into play for you. Obviously, they can't offer anything of value, of specific value to induce an enrollee to select them as the provider, and they can't expect or accept any additional compensation for the plan for marketing activities. So there are some things they obviously can do. They can provide the names of the different plans that they have in play that they're part of, and that's important to note for us, because if we go into a provider's office and we know they're contracted with multiple organizations and they're providing information only for one, it's mandated if the information is provided to them that they supply and provide that information for the multiple carriers. So it's a great way to get in with some different physicians. So something that comes into mind right there as to what they can and cannot do. Keep in mind that they can only do a delivery of information for marketing materials and outside of areas where the care is actually delivered. So these are, common entryways, vestibules, cafeterias, conference rooms where they can do it. So be mindful of where the material is placed as well. We have to be very, very cognitive of the fact that a provider can do some things announcing their affiliations and do mailings on their own behalf in different circumstances, but we have to be careful about how we become involved in a mailing such as that in order to stay within guidelines. There are also things that the providers can do for the special needs plans. This is particularly of influence to us now because this is a SNP/SEP opportunity. Some docs like to market those programs, some don't. Be mindful of their preference and what they're looking to do with their practice. So different things that come into play as well. We have to be careful about making certain that all the material that's placed within a provider environment is an approved piece, and we want to make certain that we be very careful about any comparison between plans as well. So that said, there are certain things that we can do. We can obviously make certain that the marketing materials that are appropriate to a practice or a provider location is appropriate. We can do camps in common areas, and we have to make certain that we have permission for what we're doing as well. You can do lunch and learns, obviously, with the staff to help them become familiar with you and your services. How you go about arranging that is something that it behooves you to make certain that you're doing it properly. We're just going to put it that way. Aleshia mentioned a bit ago, too, about how certain physicians are looking to grow their practice and certain physicians are looking to basically maintain where they are. It depends a lot, going back to a very early slide, as to are we established or are we looking to grow? Making a location aware of different opportunities in the community can also build your relationship and make certain that you have an opportunity to actually be of help to the people that you're looking for help from. Getting to know the folks has been already talked about, making certain that we provide information to them and how it affects their way of doing business. There are certain circumstances where you'll run across a particular office that, oh boy, I've been in there a half a dozen times in the last 6 months, always done really well. You hit them a time where it's a bad day, and we've all had them. And they may have had a bad experience with a claim or a patient or whatever the reason may be. It's very important we don't take it personally. We don't pretend to know all the answers, as Aleshia said, and we look to be certain that we can help provide a resolution to challenges that they have without making ourselves a provider representative or represent ourselves as such, because we're not. We're there to perhaps be a liaison, but following up on those challenges can make some big inroads for you. It's all very important that we treat the providers with the respect that they have earned, and we look to earn that same respect. So we need to act professionally, build the trust, do the follow-up, and create the relationship we need to do. So some of these same things will come into play with other areas of providers. So dealing with pharmacists, you have some of the same concerns, a little bit different circumstance because it's much more of a delivery rapidly than a true consultation on a extended period. We all have the little places in the pharmacies that you can chat with the pharmacist, but it's different than a doctor's appointment. Obviously, with a pharmacist, it's important to be cognitive of the list of medications that come into play. And if we're dealing with a chain, be prepared for dealing with mother corporate. You'll have a number of different carriers that will offer you an opportunity to market with pharmacists, particularly during AEP, but it's an opportunity that is an ongoing opportunity, so that's something to be prepared for and something to map out as we establish our target market for our practice. They have some of the same challenges that you have with a doctor. They have some of the same opportunities where consulting with a pharmacist for their own personal needs can make a difference in your practice as you act as an independent insurance agent. Dentist, well, we've already talked a little bit about the fact that dental programs are regulated differently than a lot of the other medical practices. There are also different dental programs out there that make marketing material available to you. There are different dental benefits as part of a Medicare Advantage plan that may offer you unique marketing opportunities as well. I know a couple of the carriers are very aggressive with their DSNP marketing material for dentists, and that's something that helps us establish ourselves in a particular target market to be who we need to be. This is an example of a piece used by one of the carriers we work with. And it's important to know that you got a full portfolio that you can work with different products to appeal to the professionals delivering the care. It's also important to note that as an independent agent, you act much as a doctor or a different provider in the fact that you are diagnosing a need and you're looking to apply the appropriate assistance, much as what the medical professionals do as well. So remember, we need to be honest, we need to be respectful, we need to be of value, both to the patient and the practice, and those magical words of thank you can make a huge difference as to how this works. That said, we have different programs in different areas that we can help you plan your use of this particular key element in the community, and we'd like the opportunity to do so. So if this is something that you feel can be a piece of your overall marketing program, make that determination, make the decision to move forward, make certain that you have the product in play, so that includes contracting and certification for it, and engage that program. Now is the perfect time to start making certain that you make yourself available to providers in the community that need your help. and in turn, that helps you help the people they're helping as well. This is the contact information here for our Dallas office. You can reach any of the premier agent success managers through the toll-free number at 1-800-365-8208 or visit our website at premiersmi.com. This is our information here with our extensions in the Dallas office, but we would welcome the opportunity to work with you wherever you are and make certain that if you're dealing with a person within the Integrity Marketing Group platform of partners, that we set you up appropriately. That said, I want to thank you for coming on the line with us today and investing the time that you have with us. Watch for the follow-up material that will come to you either today or tomorrow, depending upon how quickly the recording will come into play for us. And watch for conversations that will be coming your way from folks looking to help you make this an integral part of your overall marketing plan. That said, once again, thanks for the investment of your time. We look forward to visiting with you in the near future, and we wish you good selling. Thanks so much. We'll talk to you soon.